Hi everyone, welcome. We're just waiting for folks to join in. It's a little early right now, but feel free to make yourselves at home. Just please remember to mute your line when you log in, just so that when we have a number of people on the call, we don't get overwhelmed with a lot of static in the background. Thank you. Good, hi everyone. I keep wanting to say good morning. Hope everyone is doing well. We're just getting logged in. Pauline, I see you're on the call. Is that the line that is going to be used for the Secretariat? Or are we still waiting for someone else to join separately? Of course, you're looking for someone else to join separately. Everyone has is working from home. So I am still looking. If you are someone who is supposed to be speaking on this call, if you could please use the hand raise function so that I know you're there, that would be lovely. Thank you so much. We will be getting started in a few minutes, just waiting for folks to log into the call. Thank you. Hi, everyone. We're about 1 minute to the hour, and we're still waiting for folks to log on. Just a reminder that if you're not talking, to please try and mute your line so that we don't get a lot of feedback. Thanks so much. I see Peter Oisnar, is that you on the line?
Yes, can you hear me?
Yes, I can hear you beautifully. Thank you. I'm just checking for our speakers. So I'm looking to see if we have others. Cal, are you on the line? Rico and Francoise. I'm not hearing anyone else pipe up at the moment, but thankfully, according to the agenda, Peter is here, so we can at least start with him when we're ready to get moving. So we'll just wait a few more minutes while people are logging in, and then we'll get the call started.
It's fine. We have a person who comes to help us in the morning with the little one, and then in the afternoon it's with us, and the other two are doing very well.
Just a friendly reminder, everyone, to please try and mute your line. We will mute you if you are having trouble finding your mute button, but just to keep the call clear. Francoise, was that you that I just saw logging in?
Yes, but I have muted myself as instructed.
Perfect. Thank you so much. All right, and now I am still looking for Cal. Did you manage to join the call? Yeah, I think I see you there.
I'm here.
Perfect. Thank you so much.
Hi, this is Sylvie.
Hi, welcome.
Thank you.
So I think we are going to get this call started. We have quite a few people calling in, and I don't want to, I don't think we'll go through and introduce ourselves, as that would take up our entire hour. We have a tight schedule today, so let's get this started. I'm just going to do one last final reminder to please try and mute your line. If you are not talking, it's just going to make everything easier for everyone to hear. So I appreciate that so much. So we are talking today about something that we are, I think, globally cannot stop talking about for the most part, and that is COVID-19. And we have a civil society working group that is going to be addressing us first and what they've been working on for a civil society statement. And we have the Global Fund Secretariat and Francoise Vanny. She will be providing some perspective from the Global Fund, and then we have some updates from some of our GFAN members, Rico, Gustav, Kalkura, and a couple of other folks are also going to be inputting at that point. And we will hopefully have some time for discussion, and we will go from there. The request on this call, so that we can get through everything, is that if you have kind of smaller questions that you want to ask the speakers, that's fine. If there's just for clarifications or whatever, but for the bigger questions, we're going to try and save them to the kind of the later portion of the call for the discussion. And those bigger questions, if we don't get to them all, we will ask our presenters to kind of give a bit more of a written feedback. So we're hoping that that will work, just so that we can get through all of the agenda items and that we can make sure everything is clear. So let's get started, and I'm going to hand this over to Peter, who's going to give the update from the Civil Society Working Group on Global Health Security.
Yeah, hi there. Here's Peter from Berlin. I hope you can hear me. Our internet here in the whole country is quite slow because everybody has home office and watches videos, of course. So a brief introduction of what we achieved so far. So you remember that at the GFAN meeting, there was a decision taken to have to create a civil society working group on global health security. It was the purpose to come up with a one-page paper that would set the context of the discussion of global health security, the context for us, and to come up with 5 key recommendations. So what we achieved so far is that we had 2 telephone conferences. Robin, Andre, Rico, Sam, Timur, myself, and Tara were in the group, and I'm sure I forgot some. Masaki was there, and yeah, James. So we discussed the issue, and we started a draft paper that is hopefully ready by the end of this week, and we really need your input for that paper. So anyone who wants to participate in this work that I'm going to present is invited to get in contact with Tara. So we really need your help by doing that. So setting the context, what we had in mind is to
Did we lose you, Peter? I think we might have lost Peter. Just give him 2 seconds. Yeah, I think we may have lost Peter.
It seems so.
Robin, did I see your name on the call? Can I be so bold as to ask you to kind of jump in and
Sure. Now, I apologize if I get kicked off. I've gotten kicked off the call twice already, so bear with me. So as Peter was saying, we've developed a draft document that we're hoping to finalize by the end of this week, early next week, and would really love other GFAN members to join in. If you're interested, to please let Tara know. And we will be also circulating the draft document across GFAN members and GFAN partners to see if others would like to sign on to this letter. I know there are a number of initiatives similar to this that are sprouting up in civil society, which is amazing. I believe, excuse me, I believe HealthGap has a virtual meeting that is being held tonight in Eastern Standard Time or Eastern Daylight Time on global health security, COVID, HIV, and public health access to justice. So there are a number of things. UNAIDS has also come out with a very good document. So talking about COVID, how it affects our key and vulnerable populations, and the importance of human rights and access to healthcare is increasingly becoming a point of discussion, which is really good to see. But of course, more is required. So the key asks that we are putting forward are really directed towards our governments. And the one pager that we're looking at is really to ground it within the context of all of the lessons learned that we've accumulated over the last 30 years in our work in the field of HIV, TB, and malaria, and apply those to the current situation that we're seeing globally. And the idea is that the one pager not only is directed towards our policymakers and decision makers, but it's also like a backgrounder that we can use in the development of other pieces of writing, whether it's blogs, op-eds, any kind of other outreach or advocacy work that we might want to be doing, just to raise the profile of the fact that human rights cannot be forgotten in pandemic responses and pandemic preparedness. So again, if you'd like to join, we would love to have you part of the group. This is the first thing that the group has taken under its belt, but I would imagine that we will be doing more over the coming weeks and months. So please, please come join us and reach out to Tara and she'll link you into the group.
Thanks so much, Robin. And thank you, Peter. I'm sorry you got cut off there. I think I saw you pop back on, but appreciate very much that. Does anyone have any kind of quick clarifying questions for Peter or Robin about the working group, or need any kind of quick clarification?
I do see from Jenny, she was asking whether or not the letter and the one pager are separate things and will both be circulated. So in fact, it's a one-page statement. So it will have setting the context, and then it will move into the 5 key asks.
Thanks so much, Robin. And I noticed that James wanted to note that there's a TB activist guide on COVID that TB Proof has released, and he's going to link it.
That's terrific. Thanks. I think I've seen it. Was just yeah, a fantastic document. So thanks for pointing that out again, James.
Perfect. Is there any other clarifying questions? You can either pop it into the chat or raise your hand. If not, we can move on to Françoise Vanny from the Secretariat. I don't really see any other questions, so I'm going to hand it over to Françoise. And just as a reminder to those not speaking, please try and mute your line. Thank you so much.
Hi, everyone. Good morning or good afternoon, depending on where you are. I hope you can hear me okay. Thank you for the opportunity. And it's very interesting to hear about the recommendations that you are preparing in terms of building on the lessons learned and making sure that human rights are protected. It's going to be also a helpful document for us as we move forward in our response to COVID. So let me try and summarize with you where we are in terms of the Global Fund's on response. And please use your mute button because I can still hear some noise on the line. So a few things. First of all, you should have received the first partners update of this year that was issued on the World TB Day a couple of days ago. With all the relevant information related to both the World TB Day, obviously, but also to our response to COVID, with all the relevant links. So please refer to that. I will provide you with more updated information today, but all the links are in that update, and we will make sure that we issue partners updates regularly as we move forward. So as you would be aware of, we are following sort of 4 work streams in terms of the response to COVID. The first one is obviously to ensure that we can continue working from remotely, and that is being done, and it's working. So fine, no major update on that front. But more updates on the following 3. So the second one is to make sure that we protect our mission and that we can still continue to deliver on our very important work. So a few things to say about that. The first thing is that we are obviously monitoring closely pledge conversion. I'm sure many of you would have some concerns about whether or not donors might be distracting their contributions to other causes. Fortunately not, this is not the case. We are not worried, we are quite confident that donors are going to meet their commitments, the contributions are coming, the agreements are being signed according to schedule, and we have no worrying sign coming our way. Actually, the experience from the 2008 crisis was that most donors stayed on board despite their difficulties. So we are confident on that front, which doesn't mean that, of course, we won't be monitoring closely and mitigating any potential risk as we move forward, but so far, so good. We have also put in place sort of business contingency plan that allows us to operate remotely when it comes to delivering our mission. One of the critical aspects that we are at the moment investing a lot of time on is the supply chain and procurement to make sure that nothing is missing. Obviously, it presents challenges both from a production side and from the demand side, as you know. So the latest update we got yesterday from our colleagues working very closely with WHO, but also with suppliers and in-country partners, is that the risks so far are low to moderate. So again, monitoring closely, but no need to panic. We are on top of it. And finally, in terms of protecting our mission, obviously an important effort has been made to ensure the grant-making process would be followed according to the agreed timeline, to make sure that there would be no disruption between the current grant cycle and the next grant cycle, which of course would be absolutely disastrous, and we don't want that to happen. So the first window for grant submission was this Monday. And thanks to a lot of effort across the entire Global Fund partnership, we did receive 50 plus submissions from countries that are currently being reviewed remotely, but still reviewed. We are very, very happy that the submissions could come in. Obviously, some concerns over the second window for submission in 3 months' time, where things might be a little bit more challenging, but we will be looking into that. So that's in terms of sort of continuity of our core mission and making sure that we are standing with the countries with support and with the people with support in those difficult times. The specific support to countries in their response for their preparedness and response to COVID has been, as you know, kicked off through the issuance of a new guidance on the 4th of March. So I think it was just at the time we were together in Amsterdam for some of us. The latest update on this guidance that allows for countries to use different flexibility mechanisms to redirect a portion of the current grants to help them address the COVID crisis. The latest update is that 21 countries plus a regional program have already requested and were granted those flexibilities as we speak. This was the update last night, and it changes by the hour. So it is possibly more now, because we know that requests are coming. So what is important to say about that, it's to our knowledge the first dollars that are actually hitting the ground, because a lot of money has been pledged, but money actually on the ground and able to be deployed. It's probably the fastest mechanism that is available at the moment. All those requests were assessed and approved within 2 to 3 days. And in terms of where they are going to, so all of that is going to be updated on our website, but happy to share that the request came from the different regions. So we did have requests from Africa, Asia, Eastern Europe, and Central Asia, and also from Latin America. So it's coming. And actually, the latest news is that we are looking at going further in terms of flexibilities, responding to some of the demands and challenges that are increasing in the countries we support. So further flexibilities are currently being explored and shaped and will be taken to our board probably in the coming days. And finally, on the sort of how we are engaging in the global health landscape as the world is trying to respond to COVID. So it goes without saying, but important to remind that we are obviously following up from the WHO leadership in terms of their normative guidance and working in very close coordination with them. We are engaging with a lot of donors and also multilateral spaces where the response to the pandemic is being discussed, whether it's G7, G20, and others, to try and ensure that there is leadership, that there is coordination, that we avoid duplication of efforts, that we focus on established and proven mechanisms that work. That we obviously increase the resources that need to go to the response to the pandemic and do it fast. And we are also very much advocating for meaningful and strong engagement from communities and civil society, because we know that it's what works and what is right and what is needed. So a lot of that is happening at the moment. Obviously, the engagement from the Global Fund Advocate Network on all those fronts is going to be super, super critical as the world is sort of shaping its response and as countries are also developing their own national response plans. So I'll stop here, and I hope it was clear, and very happy to address any questions or comments you might have. Over.
Thank you so much, Françoise. I appreciate that. Does anyone have any questions for Françoise? Any clarifying questions? Anything at all? You can put your questions in the chat or use the hand raise function. If you are on the phone and would like to ask a question, please unmute yourself, and we will start with those on the phone that have called into the call. I am not seeing anyone unmuting themselves. Are there any questions from folks that are online and can raise their hand or put a question into the chat box? I see Estelle, you have a question?
Can you hear me?
I can hear you.
Oh, great. Thank you. Thank you, Françoise. This was very clear. However, regarding the flexibility mechanism which are starting to be implemented in countries, I have a question. Well, not a question, but more a comment. From what we see in our member countries, it is quite difficult for the civil society to be involved in all these discussions between PRs and secretariat. And as you may know, community are on the front line of this new epidemic. So they have some needs that are not really well transferred to the global fund. It was just a warning I wanted to give because most of our structure are in country which are in a lockdown now. It's very difficult. They are still carrying on work with sex workers, drug users, etc., but nude. So just a point of attention on the flexibility mechanism and what is discussed between PRs, MOH or Global Fund. I think that the people most on the ground are a bit forgotten there.
Thank you, Estelle. Are there any other questions? Francoise, did you want to reply to that?
Yeah, sure. I mean, we are acutely aware of the challenge that you are raising, and it is affecting pretty much civil society and community partners in all countries. So this is really something that we are trying to address in raising, in a way, the case for civil society and communities to be engaged in not only in the delivery, but in the shaping the response. So that's one of our concerns, one of our advocacy messages, and one of the things that we would like to support as we move forward.
Tara?
Yeah, David, I see you have a question, and I also have, I believe it's Olive has a question, and Anthony. So why don't I start with David, then we go to Olive, then Anthony.
Yeah, hi. David Brodden with Results in the US. Just to make a very quick comment and see, Francoise, if you had any response, which is that we had a call earlier this week with McGill University that Dr. Madhukar Pai and his team pulled together. And it was very powerful looking at the unique vulnerability of TB programs because of how labor intensive they are over a long time period, how the patients present with some of the similar symptoms as COVID, such as coughing. And then, of course, in TB, we still have antiquated technologies. So I think that it's definitely worth paying attention to with some special attention, the unique vulnerability of the TB programs in particular, and how they rely to a really great extent on ministries of health and their own domestic resources in some cases, and personnel. So I don't know if that's something that you have focused in on, but I think it's really worth some attention. That when it comes to TB stigma, just for instance, if someone is coughing, obviously we want them to be evaluated for TB in the high burden countries. But then will they be afraid to present, or will healthcare workers be afraid to even evaluate them unless they, of course, they have some protection because it could be confused with COVID. The other thing that was brought up was the competition for resources, in particular the expert device, because the expert device can be used to also diagnose COVID.
Thanks, David. I believe Olive, you had a question?
Yes, thank you so much, Tara. I'll be giving an update on the conversation we had as Anglophone Africa CRG platform later, but I just wanted to quickly ask Francoise. Thanks so much, Francoise, for the update. We were informed some of our countries were actually applying, or can I say reprogramming, for accessing the Global Fund grants. However, we found that some of the country teams were informing civil society that this is mainly for emergency response, and that civil society may not necessarily come in to participate or to engage in these processes. I just wanted to know whether that is true, because we were being directed to the funding that is coming into the country from the World Bank. So I would like to get information from you on that. Thanks.
So, sorry, did you say that you were directed to the World Bank by who? Couldn't hear well.
Okay. Some of our colleagues were engaging in some of the Southern African countries, wanted to engage in the reprogramming process. However, they were informed that the Global Fund reprogramming is not meant for civil society, and that there is another opportunity that they should look out for, which is funding from the World Bank. So I just wanted to know whether that is true, because this information was coming from some of the country teams.
Thank you so
Tara,
much.
do you want me to address those, or are you taking more questions? Just checking.
Oh, what I was going to do is just see if Anthony wanted to ask his question, or if he thought that was a larger question we could discuss later. And then you could answer those three, and then we would just move on to the next section, and then there'd be an opportunity for further discussion later. Anthony?
Sure. Yeah, it can be answered now or later. There was some discussion about potentially the application windows being either extended or potentially delayed. I just wanted to see if there has been any official guidance on that. Thank you.
All right, Francoise, if you could go ahead and answer those questions, I think that would be a good point now. Thank you.
Okay, I'll try to address as much as I can, because things are indeed evolving quite fast. So the specific vulnerabilities actually of all the patients and the communities we support is something that we've been strongly advocating for. And in the case of TB, you would have seen perhaps the messages coming out from the Secretariat in the context on the World TB Day, and really making all the connections as you have very well outlined in terms of vulnerabilities that are specific to our TB work, TB programming, including indeed the competition for the gene experts machines. So all of that is well understood and taken on board. New guidance has just been developed on TB and COVID-19, which is aiming at supporting really the country teams to address some of those vulnerabilities now. So this should have reached the country teams by now, because I think it was issued just yesterday. In terms of the reprogramming process not meant for civil society, I'm not quite sure where it comes from and what it means. I mean, there is nothing that prevents this flexibility mechanism to engage civil society. The truth is that obviously we are facing different, very pragmatic challenges. One is the time, which is, those flexibilities are meant to be used quickly. And secondly, the connection issues in lockdown context. But it's certainly not a guiding principle that civil society shouldn't be involved in the reprogramming and in the subsequent activities that would result from that, and potential extended flexibilities if those are approved in the coming days. And if I understood correctly, the last question was about the second window and the guidance for that. That's still in the works. We were very much focusing on the first window. As I said, it was very challenging to get the submissions in on time. We expected, I think, or we had scheduled for 57 submissions. We received 52, if I'm not mistaken, so it's very good. But we will need to look into how we make that work for the second window, which is more challenging. So I don't have a specific guidance for that yet, but I hope I captured the question right.
Thank you so much, Francoise. If anyone has any further questions, can I suggest that you pop them into the chat window, and we'll move on to our next call. And if you're on the line, you can always send the question to me via email, or there'll be an opportunity later on in the call to for additional questions. What we wanted to do now was move on to having some updates from some of our partners here. I can see that Cal is on the call. Rico, are you on the call? I think perhaps something's come up and he's not able to. I did share the link of the statement that GNP Plus put out. It's in the call slides, and I have been trying to actually make the slides go for this call so that you can all see them, and I can't make them move on. So you're stuck with just the initial page, and I can't make it. But if you open up your email that I sent this morning about a half an hour before the call, there are a bunch of slides linking to some of the global funds, what Francoise referenced, the Rico statement, and Cal's page. So why don't we start with Cal? Could you talk a little bit about what you're working on?
Hi everyone, it's Cal here. Thanks for the opportunity to go on to your call today. Yeah, just to give a bit of an update for the stuff that I'm helping to facilitate. I chair the G7 Global Task Force, which focuses on the G7 and is comprised of about 400 individuals and 180 organizations. But we sort of pivoted, as a lot of people have done with COVID-19, and pulling together what we're calling the COVID-19 Advocacy Response Coordination Hub, which is two things. One is the website, which is the sherpatimes.com. And what I'm doing there is posting sort of updates, sort of recommendations to governments, advocacy around COVID on a range of issues, not just health, but in terms of rights and the economic issues, education, food security, some of the broader issues as well. So first of all, I encourage you, if you take a look at the Sherpa Times, and if you have any updates or information you think might be relevant, just email them through to me. It's all on the site. And again, perhaps we can send that around in the chat room, but it's at thesherpatimes.com. But what we're also doing, we're holding a weekly 30-minute check-in call of advocates interested in sharing information and looking at joint initiatives around COVID-19. The call will actually happen just after this call at 10 a.m. Eastern Standard Time, and it happens every Thursday. And the ambition there is really to create a space where advocates can come together and share information and undertake joint initiatives. And the one joint initiative that we're working on at the moment, and hope to have up and running in the next week or two, and I think it dovetails well with the work you guys are doing, although conscious there's always fear of overlap and duplication. But what we're looking to do is put together a set of principles for governments when instigating COVID-19 responses, some broad principles that they should heed when implementing measures. And the idea for this principles would perhaps be turned into a sign-on letter for organizations that would go to governments and possibly be sent to a letter of the editor of a major leading international newspaper. And that would, I think, just sort of the broad principles that we think people should keep in mind when they're instigating responses to COVID-19. And the second part of that would be a toolkit. And I'm using the word toolkit to be a little bit less, perhaps the word aggressive is, advocacy type thing with their asks or demands, but really to put together a toolkit for governments when they're implementing the COVID-19 responses to give them guidance what they should look out to, should be informed about, including marginalized groups, vulnerable groups. And the idea of the toolkit would be quite comprehensive. So it would cover not just health issues, which I think, again, we could talk about how the work you guys are doing how they could fit in, but also looking at rights, looking at how to, some of the education issues, looking at trade, equitable access, some of the financial issues around labor and jobs. And the idea would this be sort of on a website, it also is a PDF, and it'd be a toolkit that governments can dip into to understand what the sort of the caution points are from civil society around a particular issue as they think through legislation or other policies to implement. So that's the sort of the main outputs we're looking at the moment, and we'll be talking about that on our call that takes place at 10 a.m. Eastern Standard Time. And that will probably take a couple of weeks to turn around. The principles hopefully should be quicker, but the toolkit itself will probably take a couple of weeks to turn around. And I envisage it being sort of a live document on a website that can be updated and altered depending on the current circumstances. We're hoping also as this goes on, hopefully we all hope that it doesn't go on terribly long, but looks like it will certainly go on for the next 3 or 4 months, is to continue to share space and conversations. And again, just to see if there's urgent response and urgent response that's needed, it can be the space where that can be brought together and informed, and hopefully get some concrete outcomes and useful outcomes for the sector and for those working on COVID-19. And again, as I say, it's health, but it's also beyond health in terms of the other rights and issues that are coming up in the face of this crisis. So I'll stop there. Again, it's sherpatimes.com is kind of where you get most of the information in term, and also the information of the calls, as well as updates, which I'm trying to add daily. And there's a newsletter that goes out every week. But again, it's a call if you have stuff that you want to share, some recommendations, some toolkits or some papers, please do send an email to me, and that the email's on the bottom footer of the website. I'll stop there.
Thank you so much, Cal. And just to remind everyone that I did send around the slides for this call, and a link to the Sherpa Times is on those slides. Right. Unfortunately, I can't change the screen for the call, so it's just not popping up. I feel like sometimes technology is not my friend. We have reached the part of the call where I start calling on people because Katie has sent me emails going, oh, this person should say something, this person should say something. So I'm going to put people on the spot. So apologize and blame Katie. She's going to kill me now. But I do know that Dr. Grania Brigden from the union wanted to say a couple of things regarding the Cepheid COVID test. Are you on the line?
Yes, I am, and I hope everyone can hear me, and thank you for allowing me to join the call today. So I think just really to just highlight to the group some of the concerns that the union has, and also potential opportunities. So I think, as was mentioned at the start of the call, Cepheid on Tuesday got rapid FDA approval for a COVID-19 cartridge. And we feel that this, particularly in the Global Fund countries, where the Cepheid expert platform is being used for both TB services and HIV services, this really this offers great potential to support the COVID response in these countries to implement the WHO sort of testing strategy, without having to procure new platforms or do a large amount of new training of healthcare workers. However, the cartridge is being made available for a concessional price of $20 per cartridge, which we really feel is really I'm trying to be polite, not a great access price. And we are also trying to find out what their plans are with regards to scaling up production, making sure that it is available for procurement in a timely way, such that we can look at ways to implement that within Global Fund countries and high burden TB countries, to ensure that we are rapidly able to screen for COVID-19 just before the epidemic takes off. So it's a kind of double-edged sword of great new development, but we are very concerned that it will actually not be made available and accessible to countries to be able to implement.
Thank you so much. I appreciate that. I'm going to pick on a couple of other people, and then we'll open up the floor to questions for any of the speakers. I had here Olive. Would you be able to speak to some of the stuff that you've been working on through ANASO and the CRG platform? Katie told me you might be able to.
Thank you so much, Tara, for this opportunity. Can you hear me?
Yes, I can. Sorry, I couldn't find my mute button. Go ahead. You're loud and clear.
Okay, thank you. So within our network, within the communication that we have, we realized that civil society were not engaging in what is happening at country level. And apart from some people saying that the space was not open, but others also specifically mentioned that they don't really understand what COVID is, and the information that is there is also quite mixed. And so there was a need to have reliable and credible information. So what we did is, therefore, we called for a call, which happened last Friday. And from there, what we did is we identified sources of information. I think that is just exactly what you're doing here, which is quite good. And we got information from different sources, including WHO, CDC, Stop TB Partnership, UNAIDS, and the Africa Union, among several. And we utilized that information. Now we are developing a core basic, a basic information package that is currently being drafted. And there was a core group that was identified, volunteers who came up, and now this basic information package will be shared to that team. However, furthermore, I said that it will be good because we cannot just have one information package for different thematic groups, different diseases. So we agreed that once this basic information package is being developed, it will be shared within the various networks, and they will contextualize it depending on the language, but just to make it user-friendly, but also to use that information to engage in different platforms at national and at the regional level. So we have a core group that was also identified, and we've developed the terms of references for the Anglophone for the Anglophone African countries. We will be having another call next week. And we hope that once we finalize developing that basic information package next week, they'll be able to share it with other networks. The other thing that came out from the call was the need for technical people who are very knowledgeable in COVID and other diseases to be able to hold webinars. So there was the need for holding webinars. So we are developing a schedule, and would request that if anyone out there knows who can support in terms of building the capacity of civil society to understand COVID as related to any specific disease, or like women, children, something like that, any topic that can be of interest. We have a lot of colleagues who are interested in learning more. I would just also, I think that was the call, but I would also just like to say that as EANASO, we have a lot of consultants who go out there, and unfortunately, one of our consultants got stuck. She was in Zambia, but then she got stuck in Nairobi at the airport, and fortunately for her, she's been able to move on to Addis, but then right now we have people who are stuck in the Nairobi airport. And that to us showed that there are the people who may be stuck in other airports in other countries. But now we are trying to see what can and how can we solve that situation, making sure that people's rights in terms of countries just coming and saying we're closing up tomorrow and people are stuck somewhere. So we still are looking for a solution to support colleagues that are stuck in Nairobi at the airport, but also we may want to see who else may be stuck in which airports out there. Thank you so much for giving me this opportunity, Tara. Bye.
Thank you, Olive. And I have one more person to pick on. Emily from HealthCap, are you on the line? And are you able to speak on some of the work that you've been doing, or HealthCap has been doing?
Sarah, it's Katie. I don't see her having joined, but we will share the Health Gap resources and outputs from that call that's taking place later today in the notes with everyone. I don't see her having been able to. It's possible we've hit our limit of numbers of lines.
Thank you, Katie. And you can all see why I'm hosting this call today and not Katie. Her voice, I don't think, could take it. Okay, so we will definitely share any resources, and I have been collecting resources and articles for the roundup that I do each month, and there will be a significant number of COVID-related articles, unsurprisingly, in that roundup. So I will send that around next week, and I will make sure to include all of the items that you have shared here. So that should have a large number of resources for folks. They include news articles and, of course, the work that we have all been doing. At this point, we're going to open up to discussion and additional questions. I already see someone with their hand up, and please forgive me if I do not pronounce your name correctly, Priyanka. If you would like to lead us off with a question, go right ahead.
Thank you, Tara. Just quickly wanted to share something rather than a question. We at the Global Coalition of TB Activists have put together a very simple, short survey that won't take more than 10 minutes, and I'll be adding a link to that in the chat box very soon. With the survey, what we are basically looking to do is to sort of float it out to all community members across the globe, and for them to respond and get back to us if there are TV services that are being disrupted because of the because of the curfew or because of the lockdown situations that the countries are in right now. So, you know, if people are able to access their medications, or if the people are able to access sort of transportation facilities to get to their nearest health facility to take up their medications, or even just being able to access testing, in the sense that if lab technicians and other people have been diverted to respond to the COVID outbreak. So we are also working closely with the Stop TB partnership and also with WHO. So once this data comes into us, we will try and help out in any which ways possible and try and support to mitigate these issues. So I'm just going to put the link in the chat box for everyone. Also, I have circulated the link on this listserv a couple of hours ago. Must have gotten buried somewhere. So just wanted to point that out. That's all. Thank you.
Thank you so much. I see a number of questions popping up, and this is also a good opportunity if you have something that you would like to share regarding what you're working on in COVID. This would also be a good opportunity to do that. There are some questions in the chat window, but I'm going to go to first Solange from ITPC Global.
Hi. Hi, everyone. This is Solange from the International Treatment Preparedness Coalition, ITPC. Just wanted to share, I put it in the chat as well, that ITPC has developed a simple guide, a sort of relatively low literacy tool to explain what COVID is, how it is transmitted, how it can be prevented, and some practical tips. It is meant for being able to download easily. We have it in French, Russian, Spanish, and Arabic. So that is something that I would like to tell everyone here. And then I had just a quick question, which I think you may have missed, was can you give us the details of the call with HealthGap? And you're also scribbling on your screen, which is hilarious. Or there's a pointer. Anyway.
I have no idea why it's doing that. I just noticed it too.
It's
And I'm
all
like,
good.
I think it's just because I'm nervously moving my mouse. And I'm just going to stop sharing my screen.
Yeah, stop sharing and start again. Maybe it will then move.
That's
Sometimes
hysterical.
That works.
I'm so sorry, everyone. Okay, so of course, in all of that, I missed your question that you had.
Oh, the question was just about the call for HealthGap. If you can give us the details for that, that's happening later. And
Okay.
then I've put the link for ITPC's guidance.
Perfect. Thank you so much. We will of course share any of that information after. I don't have the health gap information at my fingertips right now. The next I see here, Ida, did you have a question?
Hello, everybody. It's Ida from Burkina Faso, working for the Francophone Africa Regional Platform. It is to share an information to all of you. We are organizing a webinar that should take place tomorrow at 10 p.m., 10 e.m. Burkina Faso, concerning COVID-19 and global fund dispositions. And it will be all in French. For those who can speak French, can be interested, they can join us. It's with Katie Fall from the regional, that is the regional advisor, regional manager for West and Central Africa of the Global Fund Grant Department. It is to share this information. Thank you, Tara.
You're very welcome. And then I see a hand up from Daxa. Daxa Patel.
Hi.
Hi.
This is Daksha from National Coalition of People Living with HIV in India, NCPI+. Just I want to give a quick update about COVID-19 and HIV community member, what we are facing challenge and how we are dealing those challenges right now, because in as you all are aware about, entire country is locked down now. And so those specifically rural people who are facing problem to access the medicine. So we are having a close coordination with our National AIDS Control Organization, NACO, and we are keep sending them state specific any challenges what we if facing to coordination with the sex, if is there any state specific. And specifically we are promoting now differentiated service delivery for ART refilling, and we are utilizing our community based drug refilling setup, our ICTC, Link ART, and specifically we are getting good help from like a blood bank and our Red Cross Society and our district AIDS prevention control unit as well, to provide. They are providing vehicle and certain support for transportation to visit rural area. The another point, we already sent one request to NACO for provide actually to reach hard to reach area. We need some additional support, and we send a request to NACO for from like Global Fund already sent one letter for COVID and HIV response and all from unspent PR budgetary provision. So we are keep following them with NACO for to manage this whole situation. So this is the quick update from our side, and this is what we are doing now.
Thank you so much. What I did want to just ask quickly, Francoise, would it be okay? There's a couple of questions in the chat that I don't think we're going to get to necessarily if we sent those to you, and if you could get us some answers back in writing on those questions, would that be okay? And then then I also see 2 other questions, and I think we have to wrap up the call.
Yeah, that's fine. I'm trying to follow up on the questions as well, but I cannot be as fast. So if some questions remain unanswered, yes, we will answer afterwards. Thanks.
I appreciate that so much. Thank you. So I see here we have Elizabeth and S. Merchant, which I'm going to go with Sarah, but I could be wrong. So we'll start off with the person whose name I'm not quite sure. Please go ahead.
So is it me who has to go?
Yeah,
This is
it is you,
Merchant.
S. Merchant.
Okay,
Sorry,
okay.
I made a random guess and I guessed poorly.
That's okay. That's okay. So let me. So I am Sylvester Merchant, and I am presently representing India Working Group. This is a coalition of TB, HIV, and malaria national level organizations working in India. I just wanted to kind of update you about the present situations, especially with the most marginalized communities, that is transgenders and MSM. What we have been able to kind of have a breakthrough is that we've approached the Ministry of Social Justice and Empowerment, I think within 24 hours we've been able to actually crack a deal where the ministry will be supporting us to distribute the food kits and also some money which will be directly going into the accounts of the transgenders, the trans people who are basically into everyday survival, like they're majorly into sex work or asking for alms. So hopefully by tomorrow we will be able to send. I think all the states of India, they have their respective zones and nodal organizations which are working on this, and hopefully by tomorrow afternoon this should be kind of done. And if everything goes well, because during this lockdown period, the most vulnerable populations, that is transgenders, they are not able to kind of come on the roads and get clients. They don't have money and stuff like that. So this is one way of how we are kind of going. We are reaching out to them. So this is just a small update. And of course, I have actually written a question, kind of a question or a query, which can be answered through an email or something. Yeah, that's it.
All right, great, thank you. What I think I'm going to try and do is take the chat conversations where a lot of these questions have been answered or not, and we'll format it into something that we'll be able to share with everyone along with the call notes. And then if there's any unanswered questions in the chat, we'll get those answers and include them as well. I think that will probably work the best going forward. So yes.
Thank you.
You're very welcome. And so we've got 2 minutes left. So Elizabeth, you've got the floor.
Thank you. So I'm with the United Nations Foundation and just wanted to mention that we have launched a COVID-19 Solidarity Response Fund, which is directed to WHO. Anyone from the US and many European countries are able to give with a tax-deductible contribution, and we have had a significant amount of success so far. We're still screening a lot of the donations just for compliance, but my expectations are that we will have at some point in the near future over $100 million coming in and going to the WHO response. I just want to flag it. You can find it at covid19responsefund.org. If you would like to make a donation or know of any private sector that's interested, we can have conversations with them as well.
Excellent. Thank you so much, Elizabeth. That's, I think, a good note to end on. I want to just thank everyone for joining the call today and thank all of the speakers on the call. I really appreciate you taking the time to share with us all of your wisdom and information and answering questions. We will the one thing I did want to say was the purpose of this call initially was going to be our meeting report and information coming out of our GFAN meeting. Clearly that did not happen in this call, but we will be sending around the report, I'm hoping, next week. And we will have, perhaps we will have another opportunity to kind of discuss what came out of the GFAN meeting on a later call or something along those lines. So again, thank you all very much. I know I have to jump off onto another call, so please, everyone, stay safe and follow your public health organizations. In our case, it's stay safe, stay home, and but keep in touch with friends. All right, have a great day, everyone.
Thank you.
Bye.
Thank you.
Bye.
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 Bye, everybody.
Bye.
Bye.